We're coming up on 2 years since the first cases of COVID were detected in North Carolina. Since then, healthcare systems and labs have put a lot of resources into testing, and it will continue to be a vital tool even as we move into an endemic phase. But how do we get from a nose swab to a definitive result?
Yeah, WCNC Charlotte's Chloe Leschner getting a look at that, getting an inside peek at the process at a state vendor's lab in Apex, where hundreds of thousands of tests have been processed.
By now, we've all taken a COVID test or two, and those samples end up in a lab like this one in Apex, where the tedious work of figuring out if you're COVID positive or COVID negative begins. It takes careful concentration and absolute accuracy.
This is really important to be able to follow that sample throughout the process. So she's scanning all of them in.
Each test tube being scanned into the system is filled with a North Carolinian sample given during a COVID test. This is where it's processed.
Try to provide that service so that people know health-wise how they're doing or what they can and cannot do.
Joanne Ajmo runs Ottendorf's lab in Apex. This is the calm after the Omicron storm. At one point, they tested 4,000 to 5,000 of these tubes in one day.
You can definitely tell a difference. You can feel a difference. The staff knows when they come in. There's just hundreds and thousands of samples waiting, and so they get busy right away.
A few months ago, they brought in this machine to help control some of the chaos. It grabs 200 microliters from each test tube and puts it onto a plate with other samples. Lab techs used to do this by hand.
We invested a lot of money in automation to be able to get people results in a timely manner.
What once took 30 minutes and had a lot of room for error now takes 7. Then another machine extracts the RNA. Once it's mixed in with other agents, the sample can finally be read by this machine. 384 people's samples can be done at once, and this is a first look at the results. A purple curve on the graph indicates the presence of the N1 protein, or a positive COVID test. This is where they noticed the first signs of the Omicron surge.
As it was November, we started increasing like 10%, 12%, and I want to say by beginning of January, we were probably about 48, 50%.
From start to finish, the entire process takes 2.5 hours. Even though they're not as busy right now, this process will become a permanent fixture in the endemic phase.
The lab is not going away. We will be here to serve the state of North Carolina. We will be here to make sure people can have their test results in a timely manner, and we will be here to help get us back to the new normal.
In the Charlotte area, Ottendorf is helping Novant Health run their testing sites to relieve some of the pressure on their staff. In Apex, Chloe Leschner, WCNC Charlotte.